Hello, everybody, and welcome to tonight's video. My name is Nurse Eunice. I am going to be one of your co-instructors, and I have a wonderful surprise for you. I am now introducing you to one of our newest instructors. So, Phyllis, would you please introduce yourself?
Yes, hi everyone. My name is Phyllis McClendon. I have been a medical assistant now for about 14 years, and I'm here to help you guys with whatever you need prep with. I'm here. So, hello.
All right, so it's very nice to have Phyllis here. So we're going to go ahead and we're going to get started. Good evening, everybody. As with all of our videos, if you haven't already done so, go ahead and get pen and paper. You're going to learn a lot. And because we're trying something new, if you hear an echo, please let us know because Phyllis is in one room in the office and I'm in another room, but we're going to try to work together tonight. So hello, Vernette, Ashley, Kelly, Karen, Fatima. Great to see you all again. All right, so question number one. Which organ is primarily responsible for filtering blood in the urinary system? Is it A, liver, B, kidneys, C, pancreas, or D, stomach? And we'll give you a few moments to figure out the That is right. Great job, team. I see the correct responses. If you chose B as in boy, you are absolutely correct. The kidneys filter blood to remove waste and excess fluids, forming urine in the process. So, when someone has kidney failure, they can become toxic due to the waste that's still accumulating in their blood. All right, so question number two will be read by Phyllis. Phyllis, if you'll
Okay, where's my slide? Okay, thank you. All right, hello everyone again. Which system is responsible for transporting oxygen and nutrients to the body's tissue? Digestive system, endocrine system, circulatory system, or the respiratory system? Give you a few minutes to answer.
And while you all are answering, go ahead and give Miss Nubian Queen an applause. Congratulations on passing your exam. You are now officially a CNA. We're so proud of you. All right, so now if you reveal the answers, Phyllis, go to the next slide.
All right, if you chose answer number C, circulatory system, you are correct. The circulatory system compromises the heart and blood vessels, transports oxygen, nutrients, and hormones to the cells, and removes waste products.
Right, great job. Now we're going to go to question number three. Question number three, the hormone insulin is produced by which organ? This one should be easy. Is it A, liver, B, pancreas, C, adrenal glands, or D, thyroid? Which hormone, which organ produces insulin? Rose passed her test too. You all are doing amazing. All right. I see some B's coming through. I see a lot of B's. I see a D. All right. So we're going to go by with what the majority of the group said. The majority of the group said B, and you're absolutely correct. So the pancreas produces insulin or hormone that helps regulate blood sugar levels. All right, Phyllis, you're up next. Unmute.
I'm sorry. All right, you guys, next question. Which muscle is primarily responsible for breathing? Is it A, um, I'm sorry, y'all, you guys, I'm so southern. If I don't say this correctly, please forgive me. But
I'll say it for
trapezius,
you. Trapezius.
trapezius, diaphragm, deltoid, and pectoralis major. And I probably pronounced that wrong. Please forgive me, but I'm working
All
on
right,
that.
so I'll say it again: trapezius, diaphragm, deltoid, or pectoralis major. So when you take a breath in and out, which one of those muscles helps you to breathe? Revealing the answer in 3, 2, and yes, Ashley, Rochelle, Lion, Jerlyn, I haven't seen you in a while. Hello. Vivian, Alan Queen, if you said diaphragm, you're absolutely correct. So the diaphragm is the dome-shaped muscle that contracts during inhalation, allowing the lungs to expand. All right, so now let's go to the next one. All right, so question number 5, which structure of the nervous system is responsible for transmitting signals between the brain and the rest of the body? Is it the brainstem, the spinal cord, the cerebellum, or the hypothalamus? My smart CNAs, MAs, future nurses. Miss Nubian Queen says B, Rose says B, Kelly says C. Let's see, do we have any other responses? Chrissy says C. All right, get those pens and paper together. Karen says A, Burnett says C. If you chose spinal cord, you are correct. The spinal cord transmits signals between the brain and peripheral nerves of the throughout the rest of the body. So when someone becomes, if they sustain a spinal cord injury, that is when they can have paralysis, whether they become a paraplegic or quadriplegic, because the spinal cord is now damaged, and so it has limited signal to the rest of the body. So the person has problems moving. So that's how I want you to remember the spinal cord. All right, so you are up next, Miss Phyllis.
All right, next question, you guys. Which system is responsible for defending the body against infections and disease? Is it A, muscular system, B, lymphatic system, C, digestive system, and D, this is my favorite, inflammatory system? You guys, bear with me. I'm stuttering again, but I'm going to get it.
All right, and so which one do you think it is, team? Is it A, muscular, B, lymphatic, C, digestive, or D, integumentary? Which one helps against infections and fights off diseases? And you are so wonderful, because I see so many correct responses. I see B's. I see the lymphatic system, which includes the lymph nodes, lymph vessels, and the spleen. It plays a key role in immune defense by filtering pathogens and producing lymphocytes. Question number 7. We're going to go back full screen again so you can see better. Question number 7. Which blood vessels carry oxygen-rich blood away from the heart? Oxygen-rich blood is the key word. Is it A, veins, B, arteries, C, capillaries, or D, lymphatic vessels? So what has the oxygen-rich blood? Everyone got that one correct. Great job, team. So if you chose B, you understand that the arteries carry the oxygen-rich blood away from the heart to the rest of the body, while the veins return the oxygen-poor blood back to the heart. So remember that cycle. All right, so we're going to oxygenate the blood. The oxygenated blood is pumped out through the ventricles, and then is returned back into the circulatory system, back into the heart via the atrium. Question number 8. Which type of joint allows for the greatest range of motion? Is it going to be A, hip joint, B, ball and socket joint, C, saddle joint, or D, pivot joint? What do you think?
Now, Shunice, you have a lot of smart people out here.
I am amazed. No one got this one. No one answered incorrectly. So everyone chose B. That is correct. So think of the hip joint. The ball and socket joints, such as the shoulder and hip, allow for a wide range of movement in multiple directions. All right, let's go to number 9. Which system is responsible for producing hormones that regulate bodily functions? Is it going to be A, circulatory system, B, nervous system, C, endocrine system, or D, respiratory system? So whenever we talk about hormones, that's usually one system. one major system. So if someone has a problem with this system, that's when they start having night sweats, their sugars can drop, a lot of stuff can go wrong. All right, so let's talk about it. Let's see what you have. I see C's. I see a lot of C's, and I see a B, and then I see another C. So you all are aware that the endocrine system consists of glands that secrete hormones into the bloodstream to regulate processes such as metabolism, growth, and reproduction. All right, question number 10. I'm going to mute. This one is going to be on you, Phyllis.
All right, ladies and gents. Okay, what is the primary function of red blood cells? What is the primary function of your red blood cells? Is it A, to fight infections, B, to transport oxygen, C, to carry nutrients, or D, to produce antibodies? Let's see. What is the primary that carries the function of the red blood cells? All right, if you chose B, I've seen a lot of B's. To transport oxygen, you are correct. Red blood cells contain hemoglobin, which binds to oxygen and carries it from the lungs to tissues throughout the body.
I'm so proud of you. All right, next question, everybody. Question number 11. Which organ is responsible for detoxifying harmful substances in the blood? Is it A, liver, B, kidneys, C, pancreas, or D, heart? Vernette says B. Let's see. Karen says A. Vivian says B. Rose says A. Paul says B. Muhammad says D. Oh, you all have given us almost a full alphabet minus C.
Almost. You're running a tight race.
So when you think about detoxification, I want you to think about A, the liver. So great job. Adam says maybe B. I don't know. And this is what this is for, just fun so you all can learn. So yes, the liver detoxifies chemicals, it metabolizes drugs, and it produces waste for excretion. Now the kidneys do excrete, but the liver detoxifies. So the liver is a vital organ also. Question number 12. Which part of the brain controls balance and coordination? Is it A, cerebrum, B, cerebellum, C, medulla oblongata? Yeah, crazy word. If you're not a neurologist, you're probably not going to say that. And then D, thalamus. All right, so which one regulates balance and coordination? I see A's, I see C's, I see B's. It's a lot of A's. Oh my God. Let's see what you remember from anatomy and physiology. B, cerebellum. That's right. So the cerebellum is responsible for coordinating voluntary movements and maintaining balance and posture. Question number 13. Would you go ahead and read this one, Phyllis?
Yes, ma'am. Yes, ma'am. All right. Question number 13, ladies and gents. Which type of muscle is found in the walls of the internal organs, such as the stomach and intestine? Is it A, skeletal muscle, B, cardiac muscle, C, smooth muscle, or D, striatic muscle? All right. Let's see what we could get. What answers are we coming up with? A, B, C, or D? All right, next unit, I see some A's and B's, and I see a C, see another B.
I want the audience to tell us, like, maybe they should start winning prizes. It'd be nice if we can, like, send them a gift card for coffee or something. And for the student who passed her exam, and I do apologize for not remembering your name, but she sent me a gift card for $100 so that I can buy coffee. Lord, she sent me enough coffee for a few months. So I appreciate you all. So thank you for watching, and thank you for whatever gifts and donations you all provide. And I didn't realize that my mic was muted the whole time. But what I was saying was that a student sent a gift card of $100 to buy coffee for our team over here. So we appreciate you and we thank you for watching. And so if you chose C, smooth muscle, for question number 13, you're absolutely correct. The smooth muscle is involuntary and is found in the walls of the internal organs, helping move substances through the body. So you don't want the stomach muscles to be striated. Things would get caught in the striated muscles. You want those muscles smooth to aid in peristalsis, or the movement of the food from, pretty much the stomach down towards the intestines. Let's go to the next one. Question number 14. Speaking of digestion, the process of digestion begins in which part of the body? Is it A, stomach, B, esophagus, C, mouth, or D, small intestines? Where does digestion start? Oh, I got like 3 C's at once. All Chrissy, Burnett,
I see
Muhammad.
C's.
So if you chose C, you are aware that, remember when we chew on the food and it mixes with saliva, we swallow it down, it goes from the esophagus to the stomach to the intestine. So the correct response for 14 is going to be C. Your mouth is where digestion begins, with the mechanical breakdown of food by chewing and a chemical breakdown by the use of saliva. So yes, Rose, it is the mouth. Question number 15. Which type of cell is responsible for clotting blood? Is it red blood cells, white blood cells, platelets, or plasma cells? And then we go to the next screen, Phyllis, if you'll read the answer. So Anne-Marie says A. Let's see who else has given a response.
I see a C. I see 3 C's.
So you think C's is it, Phyllis?
I think C might be it. Yep.
Let's see how smart our students are. All right, so
C, it is platelets. Platelets are small cell fragments that play a key role in blood clotting to prevent excessive bleeding.
Perfect job, everybody. All right, so I'll read the next one. Question number 16. Which structure in the respiratory system is responsible for gas exchange? Is it A, bronchi, B, trachea, C, alveoli, or D, larynx? And which one is responsible for the gas exchange? Adam said C, and Adam said it fast too. Miss Nubian says C.
Another C coming in, Nurse Eunice.
I think I need to stop using C's as the answer option. I think.
Yes. That one.
All right, so everybody, alveoli. So think of those little sacs at the very base of the lungs. So the alveoli are the tiny air sacs in the lung where oxygen and carbon dioxide are exchanged between the air and the blood. So when we ask you to have your patients take a deep breath in and out, we're like, hey, use that instillment spirometer. Take a deep breath in to expand their lungs. They're expanding those air sacs, the alveoli, and that's going to help them, of course, with their oxygenation, but it's also going to help them cough up mucus. So encourage your patients to use their instillment spirometer. We say every commercial break, but if you can at least remind them every hour, that's going to help them heal faster to get out of that hospital and they have less respiratory issues. Question 17. Which layer of the skin contains blood vessels, nerves, and hair follicles? Is it A, epidermis, B, dermis, C, subcutaneous layer, or D, stratum corneum? I love when you all don't put the answers in fast. That means you're thinking about it.
Oh, I see some A's. I see a B. See a C.
All right, so no one knew what the stratum corneum is. I'm going to be honest, I don't know what it is either. So everybody knew it wasn't D. So for this one, if you chose, Phyllis.
If you chose B, dermis, you are correct. The dermis is the middle layer of the skin that contains blood vessels, nerves, and hair follicles, providing nourishment and sensation.
right, so our next question, team. Question number 18. Which system helps maintain the body's water balance by removing excess fluids? Is it A, digestive system, B, urinary system, C, endocrine system, or D, muscular system? I like to move the fluids. I like to.
Move it.
Hold up, I missed it. Yes, yes, everyone. This was super easy. So for this response, it's B, the urinary system, primarily through the kidneys, which help to maintain water balance by filtering excess fluid and waste from the blood. Question number 19. Which component of the central nervous system is responsible for higher level thinking, memory, and decision making? Ooh. Is it A, brainstem, B, cerebrum, C, cerebellum, or D, hypothalamus? Oh no, I am blessed by the best. You have not failed this test. It's just that we are going to emphasize more anatomy and physiology. So you usually do really well with tests. And so we're just going to actually help you with your A and P, getting you ready for nursing school. All right, team, what are our responses? I see D's. I see. Oh, I saw every letter. Did you see every letter,
I
Phyllis?
think I saw a little bit more B's than anything, though.
Anything else? Yes, great job. Hold up. Let's give them applause, Phyllis. So if you said cerebrum, you are correct. The rationale, the cerebrum is the largest part of the brain, responsible for cognitive functions such as thinking, memory, reasoning, and voluntary movements. All right, next one, question number 20. Which of the following organs is part of both the respiratory and the digestive system? Oh, Ashley and Mona, they came fast. Is it A, esophagus, B, larynx, C, pharynx, and then D, stomach? Which one is part of both systems? Adam gave an applause too. That's right. Celebrate your accomplishments. You all are doing well with this test. All right, so Nikisha says A, Hawanatu. I hope I didn't mispronounce your name. Said B. Buck says A. Nicole says D. Chrissy says A. Adam says A. We're revealing the response in 3, 2, and it's the pharynx. Good job. It serves as a passageway for both air, respiratory system, and food digestive system. So if I had a treat to give you all, I would definitely give you a treat for answering that one because that was a really hard one. Question number 21. Which gland is referred to as the master gland? Because it regulates many body functions through hormone secretion. Is it A, thyroid, B, pituitary, C, adrenal, or D, pancreas? Hey, Renee. All right, so Blessed by the Best says A. Let's see. Vernette says D. Ashley says D. Alan Queen says B. Lynn gave us 2 answers. A, B. All right, everybody. We're going to correct response in 3, 2, and it is B. The pituitary gland is called the master gland because it produces hormones that regulate many of body's other endocrine glands. So master gland is pituitary gland. All right, question number 22. Phyllis, can you read this one?
Yes, ma'am. Which type of blood vessel carries blood back to the heart? Is it A, arteries, B, capillaries, C, veins, or D, lymphatic vessels? Let's see how can I get those answers in there. All right, Nicole just said B.
And then Paul and Richard said C.
Buck
A
and
lot
Kelly,
of D's and a lot of C's.
All right, Nurse Eunice, you want to give me the answer in 3, 2, 1.
It
All
is
right, C. If you said C, way to go, you guys. It's veins. Veins carry deoxygenated blood from various parts of the body back to the heart for oxygen, basically oxygen.
perfect. Question number 23. The smallest functional unit of the kidney is called A, alveolus, B, nephron, C, glomerulus, or D, loop of Henle. And then Renee, you can't remember which ones carry the blood away and which one carries it back. All right, we're going to put it in the chat for you, Renee. All right, so which is the smallest unit of the kidney? All right, so Renee needs to know about veins, arteries, and capillaries. I think that would be a topic of a good video. What about you, Phyllis?
I think that'll be a good one too.
Right, we'll cover the circulatory system. Thank you, Renee, for letting us know what your needs were. All right, everybody, revealing the response in 3, 2, and 1. Nephron. So the nephron is the smallest functional unit of the kidney, responsible for filtering blood and forming urine. That's right, Melissa. Yes, you got this, girl. All right, question 24. Which part of the digestive system is primarily responsible for nutrient absorption? All right, so is it A, stomach, B, small intestine, C, large intestine, or D, esophagus? Which one of these organs are responsible for absorption? And then Phyllis will reveal the answer and also tell our viewers what the correct response is.
Yes, ma'am. So the answer is B, small intestine. The small intestines is where most nutrient absorption occurs during digestion. The large intestine absorbs water and electrolytes, produces and absorbs vitamins, and eliminates waste.
Okay, so now you know the differences between the functions of the small and the large intestine. Question number 25. Which system works with the skeletal system to facilitate movement? There's no reason why you should get this answer wrong. Is it A, circulatory system, B, muscular system, C, nervous system, or D, endocrine system? Which of those systems work with the skeletal system? And Adam, thank you. So he applauds, everybody. I love this. Adam is like my new best friend.
All right, next minutes. I see a lot of beads coming in.
I think you're right. Let's see. In 3, 2, and yes, you all are correct. The muscular system works with the skeletal system to enable movement by contracting muscles, which pull on bones. I'm going to miss them. We're almost to question number 50. It goes by so fast. Question number 26. Which of the following is a function of the integumentary system? Is it A, protection from pathogens, B, oxygen transport, C, hormone production, or D, blood filtration? So Adam recently went to school for medical billing and coding. I took a accelerated medical billing and coding course. It was a 1-week class. It was a crash course. I studied for a month, but I was able to remember and pass my test. And then Adam, guess what happened? After I passed my test, ICD-9, they switched to ICD-10 and I was out. I'm like, look, I'm not doing this. All right, so question number 26, the answer is A, protection from pathogens. So the integumentary system or the skin serves as a barrier against pathogens and helps to protect the body from injury and dehydration. So not only is the integumentary system the largest organ, it's one of the first barriers to prevent injury and also infection. So I'm not Adam. If anyone ever contacts me about medical billing and coding, I'm sending them to you. So PCS, I'm good. I'm good. If the robot can't do it, I can't do it. Question 27. Which organ produces bile to aid in digestion? And you know, even I got this one wrong. So it may not be what you think. Is it A, pancreas, B, liver, C, gallbladder, or D, stomach? What are the viewers saying, Phyllis?
I see some B's coming in, and it's a tie right now. Well, one ahead. Up, B is ahead. B is ahead. They are in the top.
And they remember. They are so awesome. So the liver, B is the correct response. The liver produces bile, which is stored in the gallbladder and released into the small intestine to help digest fats. And so anytime I think of bowel, I always think of the gallbladder. I totally forgot that the liver is what actually produces the bowel that's stored in the gallbladder. So I'm so proud of you all. Great job, team. All right, question 28. Are you able to take care of this one, Phyllis?
Yes, ma'am. I think I got this one. All right. Next question. Which system controls and coordinates the body response to stimuli using electrical signals? Is it A, the endocrine system, the nervous system, respiratory system, or the immune system?
All right.
Let's see what we got coming in. I see some B's.
So I think unanimously everyone knows that the response was B, the nervous system. So the nervous system controls body functions by sending electrical signals through neurons to communicate with muscles and other organs. All right, here we go. Question number 29. Which white blood cells are primarily responsible for fighting infections? Is it A, erythrocytes, B, thrombocytes, C, neutrophils, or D, platelets? Which one fights the infections? When you're looking at that CBC, a complete blood count, how would you know if your patient has an infectious process? Which of these would be elevated?
I see B's.
I see a lot of B's. I see, oh, nope, I see the whole rainbow. I see all the alphabet now.
I was going to say, I see all of them now.
Revealing the answer in 3, 2, 1, the neutrophils. Yes, are a type of white blood cell that helps to fight infection by engulfing and destroying pathogens. So anytime I think of a neutrophil, I think of Mrs. Pac-Man and, and the germ on the pellets. So the neutrophils engulf, okay, and destroy the pathogen. Yeah, I'm showing my age. I'm sorry. Question number 30. Which of the following bones is a part of the axial skeleton? Is it the femur, skull, tibia, or humerus? Kamara says B. Oh, they slowed down the answers on this one. All right. Rose says B. Everyone's saying B. You know what? Everybody who says B.
Way to go.
Great job. So axial, straight down the center. So B, the axial skeletal is the central core of the body, made up of 80 bones, including the skull, vertebral column, and rib cage, which support and protect the body's vital organs. So perfect. I'm so proud of you all. Adam, you're not rusty. Axial is appendicular. Whatever. See, I've been a nurse too long. I'm gonna have to look that one up. I'm trusting your word on that one, Adam. 31. Which valve prevents the backflow of blood from the right ventricle to the right atrium? So think about those valves within the heart. Is it A, the aortic valve, B, the pulmonary valve, C, mitral valve, or D, tricuspid valve? Kelly says B, Nicole says A, Villain says D, Rose says I'm very happy, as you should be. We have A's. Chrissy says A, Paul says A, Richard says B, Nikisha says A, Imani says B. Revealing the answer, everybody. 3, 2, and I think it was Buck. Is Buck the only one who said D? I think it is. Great job, Buck. The tricuspid valve prevents blood from flowing backward from the right ventricle to the right atrium during ventricular contraction. All right, let's go to the next one. 32. All right, so which part of the brain regulates vital functions such as heart rate, blood pressure, and breathing? Is it A, cerebellum, B, medulla oblongata, C, hypothalamus, or D, pons? Which part of the brain regulates vital functions such as heart rate, blood pressure, and breathing? That's right, but great job on that last one. All right, so I see Renee, all my tests ain't about you. I love you. So, Renee, you can't be a nurse if you don't know anatomy and physiology. So, the purpose of this is to refresh your memory. There was while we're waiting for the answer, recently, I just posted it in the community. There was oh, sorry, I didn't mean to put it on you. I apologize, Phyllis. There was a doctor who was supposed to be removing a patient's spleen, which is located on the left. Instead, he removed the patient's liver. The patient died. You cannot live without a liver. So we can do transplants, but he literally took out the liver. And then he went and told the family that the organ that he removed was the largest spleen that he ever saw. So the reason why we're doing anatomy and physiology is because I need for you all to be knowledgeable caregivers who are going further, who are going to be nurses, respiratory therapists, etc. So if you don't know the basics, your patient could be scheduled for a spleen removal and your doctor could be operating on the incorrect side and you wouldn't even know it. So that's why we're doing anatomy and physiology. And if you chose B, medulla oblongata, you are correct because it controls autonomic functions such as heart rate, breathing, and blood pressure. So I need for you all to be not as smart as a nurse because we need to get you to that level, but I need you thinking about the big picture because what we do matters. And if we don't know the basics, if we don't know anatomy and physiology, we are not safe caregivers. Question number 33. Would you please read this one, Phyllis?
Yes, ma'am. The primary function of the respiratory system is to A, supply oxygen and remove carbon dioxide, B, transport hormones, C, regulate body temperature, D, control the nervous system.
All right, revealing the answer in 5, 4, 3, 2, and a lot of A's.
Oh,
And you all are absolutely correct. A, supply oxygen and remove carbon dioxide. So that is the purpose of the respiratory system. Question number 34. Which of the following bones is found in the leg? Is it A, ulna, B, radius, C, femur, or D, humerus? Which one is found in the leg?
I see some A's. I see a lot of A's.
A lot of A's, so let's see. There we go. We have some C's now. Yes.
Oh, we got C's.
So the correct response is C. The femur is the thigh bone and is the longest and strongest bone in the body. So the femur is found in the leg. Question 35. Which organ is responsible for producing most of the digestive enzymes used in the small intestine? Is it A, liver, B, stomach, C, pancreas, or D, gallbladder?
I see the alphabet again, Nurse Eunice.
Alphabet again. Yeah, you see everything. All right. So if you'll reveal this one for us, Phyllis, question number 35, the answer is?
It is C, pancreas. The pancreas produces.
Oh, Adam said A, B, C, and D. Adam.
Well, the pancreas is the correct answer. It's C. If you chose C, way to go, guys.
All right. So let's go to the next one. Question 36. Which of the following is a component of the skeletal system? Is it A, tendons, B, muscles, C, bones, or D, skin?
All right, let's see what we get, Nurse Eunice. All right, I see C and D.
I see a lot of C's. You're right. I see D's. All right, we're revealing the answer in 3, 2, and if you said bones, you understand that bones are a part of the skeletal system. So you are absolutely correct. And so what is the function of the skeletal system? It provides structural support, it protects the organs, and it aids in movement. Question number 37. Phyllis?
Yes, ma'am. Which blood component is primarily responsible for carrying the oxygen? Is it A, white blood cells, B, platelets, C, plasma, D, red blood cells?
Let's see. This should be easy for you all. We've done a lot
A,
of
B,
videos.
C, R, D. What do I have?
All right, looks like Incredible says D. Vernette says D. Buck says D. Or A says D. Marsha says D.
So
Imani.
between
Oh,
C
yeah.
and D, let's see who the winner is.
All right, in 3, 2, and all right.
So D, if you chose D, red blood cells is the correct answer.
All right. If you'll read the rationale, Phyllis.
Yes, ma'am. Red blood cells contain hemoglobin, which binds to oxygen and transport it to tissues throughout the body.
Right. So now, question number 38. Which system is primarily involved in maintaining homeostasis through the release of hormones? Is it A, muscular system, B, endocrine system, C, integumentary system, or D, skeletal system? And now a key word in that question was hormones. Which system is responsible for hormones? All right, we see C's, we see B's.
It's a race. Oh, got another B for the tiebreaker.
We got a lot of B's. All right, Nicole says D. Let's see. Karen says C. All right, here we go in 3, 2, and it is the endocrine system. So the endocrine system releases hormones that regulate various body functions to maintain homeostasis. Remember, one of the organs would be the pancreas, and it releases a hormone called insulin. And so if someone has too much or too little insulin, their sugars could be high, they could be low. So when you think of the endocrine system releasing hormones, I want you to be thinking about that. Think about somebody who needs insulin injections because the hormone within their body, they don't produce enough of it. Question number 39. Which part of the eye is responsible for focusing light onto the retina? All right, is it the cornea, iris, lens, or pupil? And I can't wait for you all to go to nursing school. I am so excited for you all. Okay, so I know everybody's not going to be a nurse. I know it, but that doesn't matter because I'm still like planting seeds where you're going to go further. So if you're not going to nursing school, whatever school you're going to, I just want to make sure that that we help you get there. And so that's why we have Phyllis now, because Phyllis is going to help the medical assistants to pass their examinations. So question number 39, if you chose C, lens, let's see who chose C.
I don't think I saw any C's this year.
If it is, I think it was Nikisha. So the lens adjusts its shape to focus light on the retina, allowing us to see clearly at different distances. Question number 40. Which part of the digestive system is primarily responsible for water absorption? You should get this right because we already talked about it. Is it A, stomach, B, small intestine, C, large intestine, or D, esophagus? Nikisha said D, and she said that fast. I think Paul said C. All right. And Marie says A. Imani says C. Renee says C. Chrissy says A. Lynn says, oh, we got the alphabet again.
Oh, now we got some B's rolling.
We got some B's revealing the correct response in 3, 2, and it is the large intestine. So the large intestine absorbs water and electrolytes from digested food, forming solid waste. Question 41. So I know in the previous one we talked about the small intestine, but it absorbs nutrients. The large intestine absorbs the water. Okay. So 41, which part of the heart pumps oxygenated blood to the rest of the body? So when you think about the heart as a house. And a house has 4 chambers. So this is my left. So we have the right atrium, we have the right ventricle, we have the left atrium, and we have the right ventricle. So which part, left atrium and left ventricle. So which part of the body pumps oxygenated blood to the rest of the body? All right, think about it. You're going to answer in 3, 2, and 1. If you said C, yes, call up. Is it Renee who said, I don't know? You got it right, Renee. So Renee, Imani, Buck, Adam. Let's see. Blessing says, How many questions we have? Rose, we have 50, and looks like we're on question, I don't know. We're
41.
okay, 41. So we're almost done. So C, the left ventricle pumps oxygenated blood into the aorta, which distributes it to the rest of the body. Question 42. Which of the following is a function of the skeletal system? Is it producing hormones, storing minerals, fighting infections, or transporting nutrients? And I want you to think about, with this one, think about the bone marrow. What is the purpose of the bone marrow? What does it do? The skeletal system. What's in the marrow? All right. I see D's. I see B's. Oh, this one's hard. They're not giving a lot of answers for this one, are they, Phyllis?
No, but I see some B's. So
B's. All right. Revealing the answer. Yes.
B.
Let's applaud. So storing minerals. So bones store minerals like calcium and phosphorus, which are essential for maintaining bone strength and other physiological functions. All right. So which muscle is known as the calf muscle? Is it A, quadriceps, B, gluteus maximus, C, gastrocnemius? Yes, I had to write the pronunciation for that one because that one's hard. Or D, deltoid, which is known as the calf muscle. Adam, man, Adam, what do you want to be when you grow up? Because I think you have the right answer. Renee says A, Kelly says C, Miss Nubian says D, Lynn says D, and I joke and I ask people, what do you want to be when you grow up? Because I think I'm grown. However, I still want to do different things every time every time I think about it. So you're always evolving, and you should be a forever student, always learning and encouraging others. And with that being said, if you chose C, you are correct. The gastrocnemius muscle is located in the back of the lower leg and is commonly referred to as the calf muscle. Question number 44. Which type of blood cells help the body fight infections? Is it erythrocytes, leukocytes, platelets, or plasma cells? Paul, I had no idea either.
I just want to ask Richard, what was H?
Richard, we don't know what H is because all right, so a lot of B's.
Let's see.
All right, 3, 2, and 1. Would you take it over, Miss Phyllis?
Yes, ma'am. Leukocytes. So if you chose leukocytes, you are very correct. Way to go, ladies and gents. So leukocytes are white blood cells, play a crucial role in the immune system by defending the body against pathogens.
Great job. Question number 45. Which organ system includes the trachea, bronchi, and lungs? Is it the digestive system, respiratory system, the endocrine system, or the circulatory system?
Let's see. I want to see if I could see 2 letters on here that they might think it is. Oh, well, I'm getting a lot of B's.
I think this was too easy for them. Let's see. Revealing the correct response in 3, 2, and you all are so super smart. If you chose B, you have it correct. The respiratory system is responsible for gas exchange, and it consists of the trachea, bronchi, lungs, and other associated structures. Question number 46. Which bone is located in the upper arm? All right, think of the funny bone. When you hit this, it's not humerus. Okay, I gave you the answer. But is it A, femur, B, radius, C, humerus, or D, tibia?
So Adam said C, Renee said D, Melissa and Burnett said B. Butler said C, Lynn said C. So Nurse Eunice, let's see what the correct answer is.
All right, 3, 2, and 1. It is the humerus. So the humerus is the bone in the upper arm extending from the shoulder to the elbow. All right, so we are almost done with our test. We have a few more questions left, so stay with us to the end and we'll answer whatever additional questions you may have. And we'll also get recommendations for our upcoming video. Oh, let me talk to you all. So if you stayed this long, you might as well make it official. Go ahead and like the video. If you haven't subscribed to the channel, please do so. It helps us with the algorithm and it helps to let other people know about us. We come online, we help you pass your test. Our job is to help you succeed. And speaking of which, let's go ahead and read question number 47. Which part of the nervous system controls voluntary muscle movements? Is it A, autonomic nervous system, B, central nervous system, C, somatic nervous system, or D, parasympathetic nervous system? I see D's, I see a C, I see two A's.
Nikisha, what is F?
What is near F? D is near F, so she probably meant D.
Oh.
Adam, stop, Adam. Adam gave every letter. All right, we're going to reveal the answer now. If you chose C, somatic nervous system, you are aware that the somatic nervous system controls voluntary movements by transmitting signals from the brain to the skeletal muscles. Question number 48. Which hormone regulates the body's metabolism? Is it A, insulin, B, thyroxine, C, cortisol, or D, estrogen?
What we're going to get if we don't subscribe?
That's a good question, lovely, Avid. We don't have anything to give you except for laughter and some practice questions. You get more practice questions. So question number 48, the hormone that regulates the body's metabolism would be thyroxine. Yes, you all are so right. So it's produced by the thyroid gland, and it plays a key role in regulating metabolism and energy production. So when someone has an issue with their thyroid gland, sometimes if it's secreting too much hormone, their eyes get larger, they're really hyperactive. But if they have low levels of their thyroid hormone, they get sleepy, they start losing their hair. So the thyroid is a vital gland that produces hormones that are needed for metabolism and energy production. Question 49. Which organ is part of the lymphatic system and helps to filter blood? All right, would you read those for me, Phyllis?
Yes, ma'am. Is it A, liver, B, kidney, C, spleen, or D, pancreas? All right, ladies and gents, I only see a B, maybe a B, C, B, B. All right, Nurse Eunice, let's see what the answer is in 3, 2, 1. All right, if you chose C, spleen, you are correct.
That's right. The spleen filters blood, recycles old red blood cells, and helps to fight infection by producing lymphocytes. Question number 50. Which system is responsible for the production of red and white blood cells? Is it a respiratory system, the skeletal system, the circulatory system, or the muscular system?
All right, I see some B's. C.
I know this one's a little hard. You see a lot of C's. All right, so let us see. Is it going to be C or B? And it is B. So the skeletal system, think of that marrow. The rationale, the red and white blood cells are produced in the bone marrow, which is part of the circulatory system. And you all are so phenomenal. So if you are interested in learning more about anatomy and physiology, go to our website, fltraining.com. And from there, you can click on, it's going to say books or workbooks. You can click on that link. You can purchase, we have anatomy and physiology flashcards. We also have other study resources, and we have loads of free study guides and other information to help you succeed. And so we're going to be on for a few moments. Are there any questions? You need more of the classes, please? Miss Newton, what do you want to learn next, dear? And if anyone has suggestions for upcoming videos, please put them in the chat. And if you have any questions, you can go ahead and ask them now. Not necessarily. People with spleen have lots of infection. No, they just have to take proper protocols. So they don't necessarily have a lot of infections, but they got to be aware of, germs. So they need to take lots of precautions. Thank you so much for saying it was fun, Adam. Lynn, you have a good night. Infection and disease, please. All right, if you'll write that down. Yes, we have a TEAS resource also. Lovely. I can't pronounce your name. Yes, it's on our website, fulfilltraining.com. And good luck on your nursing entrance exam. I know you're going to do well. Can't remember when last did this. You're so welcome, Richard. You're currently in the course. So Miss Nubian, you're already in the A&P course. I'm so proud of you. And blessings to you also, Paul. All right, everybody. So if you don't have any questions, we're going to be logging off. And if you all would please give a round of applause for Phyllis. This is her first time doing this, so I know how nerve-wracking it is to get on camera to help people. But we're going to be helping CMAs, CNAs, RNs, LPNs. We just want to make sure everybody gets to the right level, the next level, and to make sure that we provide, just great patient care. Remember, if you're not doing this for the patient, don't do it at all. Get out of the healthcare field. So everybody have a good night. And tomorrow video, but that video is going to be in Haitian Creole. It is going to be, we have another, we have a translator now. We're also looking for a translator translating Spanish, because we get a lot of people come into our office and English is not their second language. We don't want to discourage them because we know they're going to make phenomenal caregivers. We just have to improve their understanding of the English language first. So tomorrow will be a video that's half English, half Haitian Creole. And so I do understand if you don't watch it, but if you do know somebody who has a language barrier, please send them to our channel. So everybody, this is Nurse Eunice and
Phyllis.
And we're going to be getting off in 3, 2, and yes, Garly, we have skills videos. We have a playlist, and our playlists have CNA skills videos. And as soon as I get Miss Phyllis and Miss Saskia, where they can run the videos independently, I'll start on the nursing skills videos. We do have phlebotomy classes here in Jacksonville, and we actually have a phlebotomy class in the morning for healthcare providers. So you all have a good night. Our website is fltraining.com for a list of our classes and those freebies. Bye.
Good night.